So we're trying to make sure it's recording. Let me just see if I can. I don't see the option either. So, yep, it looks like it's recording. So we are taping this. So if you have coworkers or other people that aren't able to attend today's, we will be posting it on our website, and I'll talk a little bit about where that would be found, so that you can not only reference this entire webinar, but also the PowerPoint, which may be helpful down the line as well. So the agenda today, like I said, is pretty lofty. We're going to give a basic overview of what IBHS is, some of the changes compared to BHRS, and talk a little bit more on high-level overview of written orders, speaking specifically about family-based RTF and different levels of care and the referral process to IBHS, and outlining what Magellan's expectations and how we can get services connected for those children coming from those levels of care, about coordinating care between the levels of care, a little bit about the assessment process, Magellan's authorization process, something new, which is Magellan's new IBHS access survey, some changes to our referral list process, and information about some resources. And we'll have questions and answers as well. And oh, resources are on there twice, my bad. So I would encourage you to put your questions as you think of them in the chat box. We do have somebody monitoring that from Magellan. They will jump in if they see sort of a trend or something that should be answered right then and there in the moment. Otherwise, we will get to the answers at the end of the webinar as well. So write them when you think of them, and we'll get to them when most appropriate. So what is IBHS? Quick level overview. So IBHS service was created when a diverse stakeholder group came together and started talking about how to regulate BHRS. The stakeholders that were involved were family members, providers, and other parties involved in making BHRS work. So in those discussions, they did decide that these new regulations would come up with a new name called Intensive Behavioral Health Services, and move to these new regulations. Again, some high-level overview. So IBHS as a level of care has three sort of main buckets or categories. The first one would be individual services, and under individual services would be behavior consultation, mobile therapy would be provided, or behavioral health technician. We've also put our evidence-based treatments in there. FFT or MST would all go into that individual IBHS bucket. There's also group IBHS. There's traditional group services as well as ABA specific group services. And then the third bucket would be ABA IBHS. And those are the four different staffing names delineated under ABA, under IBHS. So providers who are providing BHRS and or want to do IBHS in their program description and in the licensing process, they would be actually licensed for one or all three of these, depending on what they put in their program description, their service description of what services they wanted to provide. So a little bit about individual services, maybe most comparable to BHRS. I don't have to read each one of them here, but this is some of the thoughts behind individual IBHS services as far as their design. And again, a little bit about group services. So it's a therapeutic service, primarily in a group format. It could include psychotherapy. Again, we talked about ABA services would be a specific carve out for group, involving structured activities, community integration activities, and that all are specific and individualized for the members' treatment goals. It can be provided in an office setting, which some of them have already been doing things like that. And the goal is to really simulate the natural or the normal setting for a child or the member. It can be delivered by a graduate level professional or an individual qualified to provide the behavioral health technician level of service. And ABA, obviously, is design, implementation, and evaluation of environmental modifications using behavioral stimuli and consequences to produce socially significant improvement in human behavior or to prevent loss of attained skill or function, including the use of direct observation, measurement, and functional analysis of the relations between the environment and behaviors. So ABA is going to look at not only behaviors, but it can also look at some skill deficits. And it uses data and analysis of the data and interventions to drive and make changes to the treatment. So just a quick overview of the changes that you might notice if you're familiar with BHRS. Okay, so some of the services that are impacted by the shift from BHRS to IBHS are BHRS, ABA, multisystemic treatment or MST, functional family therapy or FFT, the summer therapeutic activities program or STAP, and the therapeutic after schools program or TASP. So those are some of the services that are impacted by the shift to IBHS. Agencies that provide IBHS must obtain an IBHS license. Under BHRS, there was no such thing as a BHRS license. Those agencies were licensed under other services. Now, if you are planning to deliver IBHS services, you need to specifically get licensed in that service. IBHS definitely made changes to the supervision qualifications. They changed the training qualifications. They changed the expectations about interagency service planning team or ISPT meeting, which is no longer required in the regulations. It is still a recommended intervention. However, it is not a requirement as far as authorization. Services require a written order and assessment. They no longer require a life domain evaluation, although that can still be utilized, and we'll talk about that a little bit more. ABA no longer requires an autism spectrum diagnosis, so it is open to other behavioral health diagnoses besides autism. Providers are required to have a list of community resources for family upon request. They do, under IBHS, there is the ability to do physical management, which has been added. It is not a requirement. So many providers have chosen not to implement that. And if they do, there are very specific procedures and criteria that need to be utilized. There is a new leadership structure contained in the IBHS regulations. And those are the regulations. All of the behavioral health MCOs have the ability to raise some of the expectations from the IBHS regulations. And I'll try to highlight some of them. There's a few that Magellan has implemented a little bit higher than the regulation standards. So just a quick visual on the IBHS process. The first step would be a written order to just initiate services. And that written order would lead to an assessment, hopefully. And the assessment would give us more information about what's needed and how to drive the treatment and the prescription, and the authorization packet would then be submitted for a full request. So just a little bit more about written orders, which is the first step in initiating IBHS services for any member. It needs to be written by a licensed physician, licensed psychologist, certified registered nurse practitioner, or other licensed practitioner whose scope of practice includes diagnosis and treatment of behavioral health disorders and the prescribing of behavioral health services, including IBHS. So that does allow for some possible changes. Some staffing credentials have recently expanded to include the provision of diagnosis and things like that. So those those professionals are going to be able to make this recommendation. The other part besides the credential is these practitioners need to be ORP enrolled, order, referring, and prescribing enrolled with a Promise ID number through the state system. That is really important. They can't just meet those credentials. They also need to be able to be officially an ORP enrolled prescriber. Those criteria are met, then based on a face-to-face interaction with the child or the member, they can write the written order within 12 months to a year prior to the start of IBHS. So that is another big change from our psychological evaluations or best practice evals that were good for a certain period of time. It wasn't a year. The written order is effective for a year from the start of the services. A psychiatric or psychological evaluation like domain eval or best practice eval, however you call it, can be used in place of a written order or as a written order, provided that the evaluation includes the information that must be in the written order. So if all the criteria are met for a written order within that evaluation, then that would be considered a written order and that would be an acceptable thing to submit. It must include, so this is some of the highlights from the regulations on what a written order should contain. It has to include a behavioral health diagnosis consistent with your ICD-10 mixed services protocol. Did put this link in here, which does refer to some of the diagnosis and whether it's a covered diagnosis or not. Clinical information to support the medical necessity of the service ordered. The maximum number of hours of each service per month using the up to language. So the written order is designed to be a little bit shorter necessarily than the evaluation process as a quick way to get services initiated and started. But there does need to be some information about the medical necessity that would be present for that. And it does make a recommendation on the maximum number of hours per each service. And we'll talk a little bit more about that. It still requires, like BHRS, that you describe the setting where the services would be taking place, whether that be home and community, in a school setting, preschool, specific delineations there. Measurable improvements identified for the therapeutic needs. So what is it that you're going to see that's going to indicate that the services can be reduced, changed, or terminated? And that you specify the IBHS service, hours, and the setting. Magellan has created a written order template. And in fact, we are probably days away from having it put on our website. Hopefully by the end of the week, we will be able to get it uploaded. I do have it on here. So if you go right now and pull our template, it's going to look different than what you're seeing. We'd actually have had it rolled out for quite a number of months, and based on the feedback, just living with it for so long, we were able to make some changes that I think will be helpful, especially to people who don't write them every day. So I would check back, in a week or so for the updated template. It is not a requirement that anybody who writes a written order and submits it for Magellan has to use this. It's something that's offered as a tool, as a guideline. So it is not a requirement though. And like I said, it's going to be on our website and we'll talk about that more. So the first page is directions. It kind of does highlight again what I just kind of talked about, which is, what's the basis of the written order, what's required, who can write it, what's needed to be included. And it gives some basic directions on how to complete it. The next page is I'll call our cover page. So there's an initial assessment request. So again, based on the comprehensive face-to-face assessment is recommended. So we recommend the assessment to start. Some of those, if you're familiar with recommending an FBA in the past, a functional behavior assessment was similar to that. You make a recommendation. IBHS does allow for services that are needed immediately to start for stabilization. And we can talk a little bit about that. Most of the time, however, if immediate stabilization isn't needed, the assessment is certainly recommended to better inform the treatment and understand what services and the recommendations that are needed at that time. So this kind of outlines in this picture what you would do. So if you have a brand new member presenting for IBHS, you would complete the cover page. The assessment is required, so it would have to be done as well. And you'll make the initial assessment recommendation. So the cover page contains some member-specific information, the date that the face-to-face interaction happened, the behavioral health diagnosis, the measurable goals and objectives, the clinical information that supports the medical necessity, and the medications. Part A is the initial assessment for IBHS. So you can see in that graph, we really tried to spell it out that this is just the initial assessment, the very start of services, and you would recommend the individual assessment for individual, for a group, for ABA services, MST, FFT. And it does give you that information about how many hours and how many days our Magellan authorizations would work for that as well. So it's just making that initial assessment. Then there's some prescriber information at the bottom. And like I pointed out to you before, you have the option at that point, if there is immediate need for stabilization, to complete the Part A for the assessment, as well as Part B to recommend the treatment starting immediately. That is optional. And then the Part B is to recommend the actual services. So you can see in the graph that we have divided it up between individual services group, ABA group, ABA, and then some of our specialty programs. So hopefully pretty self-guided as far as making the recommendations for the actual service, such as a behavior consultant. Then they would go by here and put the maximum number of hours per month. If those of you who are familiar with BHRS, most of those prescriptions were in a per week. And under IBHS, they're looking for that to be per month, giving a little bit more flexibility based on the clinical needs to be able to deliver the services. So they would check off what's appropriate. If it's a BHT, they would have to indicate the location of the service, if it's in a school setting or if it's in the home and community. And you can see there's even spots for an evidence-based treatment. And you can look at the rest as well. So the written order and assessment agreement. So after the written order is done, and we're starting with the assessment recommendations should be based on a thorough assessment that was completed and that may help refine the recommendation of the hours accordingly. Again, the written order is designed to be a quick snapshot to get services initiated, not necessarily as thorough as an evaluation has been previously. So the assessment will really help to inform the prescription as well as the treatment plan, hopefully. So the assessment prescription, so in the assessment, they also need to make a recommendation on services and the amount of hours. They don't have to match the maximum prescription, but as long as they don't exceed the prescription, the written order and assessments are considered to be in compliance with each other. If the assessment recommendations agree with the written order, so they're up to or underneath, those would be compliant, and they can submit that and they can submit and proceed with an authorization packet. If the assessment at the end recommends something different than the recommended written order, then there's a few options here. The provider should go back to the written order writer, which might be you guys, with the updated clinical assessment and review the recommendations. Makes sense. You would say, hey, here's what I came up with. Look it over, see if that impacts what you're saying. Here's what my thought was based on what I read when I observed clinically. The written order writer can then say, oh, you know what? this really did inform my decision making, and I'm going to make an adjustment to my recommendation. And then they would document that accordingly. If the provider is unable to collaborate with the written order writer, they can look at possibly exploring a new written order. If that should happen, all of those written orders, however, would be submitted with the packet for review. There are things, previously in BHRS, we had evaluations that had addendums. Written orders can be updated. We're calling it the written order update. The written order would have to be updated within the 12 months of the original life of the written order. It doesn't require a face-to-face. The updates can be based upon new clinical information from the assessment. So midway through, there's a change in presentation. The behavior consultate, the BC reassesses the clinical and says, hey, written order writer, there's been a change. We need to increase this prescription. Here's the clinical to support that. And then the written order writer can write an update from there. An update can only be done by the original written order writer, not a different person. And it should not extend you're unable to extend the life of the authorization based on that non-face-to-face contact. So in order to get more time in services, you would have to have a face-to-face written order done. So some examples of IBHS written order language, broken down into the 3 buckets and categories: individual services. So you can see behavioral consultation, up to 12 hours per month. So the provider might be delivering, 3 hours per week in general, but they may vary that, but it can go up to the 12 hours per month. And you can see the mobile therapy. These are, again, just some random examples on how you would write the written order language to recommend the services. Just let you look at that. And again, notice it's saying up to, it gives the hours and it gives it in per months. And if as appropriate, it will tell you in what setting. So to talk a little bit more specifically about each level of care and the process on how to initiate IBHS referrals. So from the family-based world, family-based the provider would write the written order, or if they feel like they can't do that, they would outreach the IBHS provider to assist with getting a written order done. The IBHS agency would then take that written order, request to Magellan the assessment authorization, which they would get. That IBHS agency would complete the assessment, develop the individualized treatment plan, and develop the whole first initial packet. The initial packet gets sent back to family-based to submit to Magellan for the medical necessity review. And if approved, there would be an unassigned authorization to be entered. So we have communicated with our IBHS providers that they assist other levels of care, whether they can staff or not, in completing an assessment, for instance. So even if they can't staff this request, like from a family-based step down to IBHS, that they hopefully can assist in doing the assessment and presenting the initial packet for medical necessity review. So that's kind of what's been outlined here. As far as the actual overlap of family-based and IBHS, 14 days, which does not count the assessment. Okay, so that's outside of the assessment. So it allows 2 weeks for collaboration and coordination and transition planning between that. So family-based would be responsible for doing the written order and or securing an IBHS provider to do the written order, and getting an IBHS provider that's able to do the initial assessment and planning and packet, whether they can or cannot staff. IBHS referrals from RTF. from residential treatment facilities. So the RTF writes the written order. They complete the initial assessment, they develop the treatment plan, and they put together the initial packet for Magellan to review, which is pretty consistent with what's happening right now with BHRS. The initial packet then gets sent to Magellan for medical necessity review, and if approved, the unassigned authorization would be entered. As is with BHRS, the overlap between RTF and IBHS is 30 days, again, minus the assessment time. Okay, IBHS referrals from acute inpatient hospital or acute partial hospital. So if a member is in an inpatient mental health facility or in an acute partial and they do not have any services, but the physician or the recommended discharge is to IBHS, this is what would occur. The written order would be completed by one of those facilities. And again, based on either our template or just the guidelines, we feel that hopefully with that support and guidance, you'll be able to submit or complete the written order. So submit the written order along with a Magellan referral form, as well as our AUD form. AUDs are required, which allows us to be able to set up the next parts of the process. Magellan will then take the written order and secure an assessment provider for IBHS. And once that packet is submitted, Magellan will also secure the staffing for that initial request once it's reviewed and approved. So those facilities would be in charge of getting a written order, getting all the appropriate releases of information that are necessary, and completing a referral form to say, here, we have completed this recommendation in written order, and Magellan, can you assist this member with making sure that they have that connection? Of course, these facilities can also outreach the IBHS providers as well and connect them outside of Magellan if they want to as well. And then if it's an outpatient mental health provider wanting to make a recommendation for IBHS, they would complete a written order, or again, you can refer the member directly to an IBHS provider to complete the written order. And then the agency would then pick it up to be able to take the written order, do the assessment and initial request. If assistance is needed by the outpatient provider in finding an available IBHS agency, we could certainly outreach to Magellan for assistance. And again, please ensure that you get the releases, the AUDs for the member or the caregiver, which allow us to communicate and share the information in order to establish the services. And then coordination between levels of care. So best practices for transitioning between levels of care. If a member will transition into IBHS from another level of care, it's expected that the IBHS agency receive the following information from the referring provider prior to beginning treatment. So the most recent treatment plan, discharge summary, if it's applicable, details about the member and the family progress in treatment in their level of care, what worked well, what did not work well, what needs to be addressed in the future treatments, ongoing treatment needs and potential barriers, and certainly the rationale for the change in level of care. Again, some of them that we outlined have an overlap, and those would certainly be the important things to highlight on a clinical level and pass along to the receiving next facility and next level of care. And this would allow for the family and the member to seamlessly transition from one level of care to another in assisting them to continue to meet their goals. A little bit about the assessment process. So a face-to-face assessment is completed by a staff qualified to provide behavior consultation or mobile therapy within, and the regs have very specific timeframes for when assessments would be completed. So it's within 15 business days or 30 business days. So 15 business days would be for individual services and group services. 30 business days is the ABA service assessment requirement. Assessments would include the following. Again, this is all in the regulations as well. They include an identification of the strengths and needs across developmental and behavioral domains of the family system, natural supports, specific services needed to support the child's needs or to support the caregiver's needs. Some clinical information would be the treatment history, medical history, developmental history, family structure, education, social history, trauma, how about their functioning level, and any other relevant clinical information. Information about their cultural, language, or communication needs, a summary of the treatment recommendations. Those are all what's expected to be included within the assessment. A little bit more about Magellan's authorization process. If an assessment is the only thing being requested, there is an IBHS registration TAR, a form that would be completed. You would submit that registration TAR requesting the authorization for the assessment only, along with the written order which recommends the assessment. And we would generate the initial assessment authorization from the submission of these two documents. The packet authorization process would include the treatment authorization request or the TAR form. There has been an updated TAR form specific for IBHS, and it already is posted on our website. The written order, again, you could use the Magellan template or not. The IBHS assessment, an individualized treatment plan, the CANS, which is a requirement within our IBHS provider network, which is the Child Adolescent Needs Strength Assessment that our clinicians are trained in. And an ISPT meeting, we said, is not a requirement as per the regs for the authorization process. Magellan did make a caveat for that. So if BHT or BHT within ABA services is specifically prescribed in a school, daycare, preschool, summer camp, or after school setting, then we are requiring an ISPT meeting to be had with that school, daycare, with that facility, have a representative there to be able to coordinate and collaborate treatment. And then we would expect a summary note to be submitted with that initial request to show the dialogue and the collaboration happening with the representative from those facilities about the treatment progress, the needs, the transfer of skill, etc. Something I wanted to make you aware of as another new resource is our new access survey for individual and ABA services. So we have a new electronic survey that goes out to our IBHS, BHRS provider network twice a month. The survey gets completed twice a month by the providers. And we also get then a report within 4 or 5 days of that initial going out. So it goes out the 1st and the 15th around, and then it would come back within 5 days from that with a report showing all of the providers that have broken down by the service, as well as the availability time. So whether it's during the day, whether it's the evening, whether it's the weekend. And it also lists a provider contact name and contact information. And I'll show you what it looks like on the next slide. This report is then shared back out with our provider network, with our county partners, internally with Magellan, and we are opening it up to anybody who is interested in being on that email distribution of the list. So if you're a family-based provider, an RTF provider, and you want to have access to that list easily, you can submit your information, and it's down here on this bottom part. If you submit your email and say, hey, I'd like to be a part of receiving the results, of your access survey for IBHS twice a month. Liz is the person that sort of oversees all of that. She can add you to that list, and we're very willing to do that. Now, if you're not wanting to do that, because it doesn't happen maybe very often for you, but you are having somebody that's getting ready for IBHS discharge. Again, anybody in Magellan has access in Magellan of PA to these results. So if you contact your RTF care manager, your family-based care manager, they can assist you with sharing that information with you so that you have the most up-to-date information per our provider network. That includes if family members called our member services line, they can get that information that way as well from our customer service representatives as well. So just a quick snapshot of an old one. It does go by county. Technically, it's all in one lump sum, so you'd have to thumb through whatever county matches with the member. Hopefully you can see a little bit. It lists the providers down here on the left-hand column, gives their specific name of a referral contact person, that referral contact person's phone number and email. And then this is broken down in behavior consultation, mobile therapy, behavior technician, if they're available to do assessments, split cases, transfer cases, or to do written orders. And the check mark means that they do have some availability. So a behavior consultation could do, they have a BC available for some daytime or after school or evenings. So I know some of the availability is often some of the issues. So we tried to delineate that to give us a little bit more specific in the availability. So this has been a new tool that's been used since, I believe it's been the beginning of September, more refined in the last month or so. And it's been really a helpful tool. So we're hopeful it's helpful in transitioning. The first was the individual services. And if you notice, this thing up here now says ABA services. So each county will have two reports, an individual report and an ABA services report. And there have been some changes to our referral list. So I want to highlight some of those for those of you who are familiar with that. And just let you know what some of those changes have been and expansions to it. So as of January 17th, that will be the last day for BHRS officially. And that will be a retired service, and IBHS will be fully executed at that point. So within the Southeast counties of Delaware, Montgomery, and Bucks County, the BHRS referral list will be closed for new initial requests, splits, and transfer cases. So right now we're working in the current list that we have. We will maintain the initial requests that we have on the list even after the January 17th. And we are working with the referral providers who referred for splits and transfers to assist them in getting connected and getting the members connected prior to this January date. But within all 6 counties that we serve, Magellan will accept and identify staffing for all new IBHS written order recommendations for the acute inpatient mental health hospitalizations and the acute partial hospitalizations, which is what we had talked about. To ensure that those members are getting connected after they leave those short-term facilities. Your agency can, of course, outreach to Magellan. Liz is our primary staffing contact, and for assistance in staffing members with complex needs, as well as members with maybe prolonged access issues. So utilizing our access survey, making those phone calls, and then maybe struggling with a unique need, that would certainly be something that we would want to be looped into to see if Liz or anybody on the team can provide some assistance. And we have been talking about the access survey a lot, so really it is being utilized by the providers, and they are completing it. So I think it is a helpful tool to be able to connect us. It does remove Magellan from the middle a little bit. Sometimes moving paperwork around was delaying some of the members and accessing the services quicker. It created another person to talk to and another kind of time frame of a delay. Hopefully, if one provider can speak directly to the other provider, exchange the paperwork, it could go more seamlessly in Magellan can insert ourselves when it's really truly needed to make that connection. So there are a lot of IBHS resources available. Magellan has their own separate IBHS page on the Magellan of PA website for the providers as well as for the members. So we also created our own IBHS email, and we would encourage you to utilize that. It's ibhs@magellanhealth.com for any of your questions. We're taking IBHS questions very regularly from our own provider network, but it could come from outside of the IBHS provider network. And you could just email your question, and it is staffed by somebody who consults with network department if needed, clinical, and we do try to work with you to secure your answers or point you to the best resource for an answer. And again, this is the direct page for the provider IBHS link. And you can see there's a little snapshot here. Every month we've had provider webinars. So all of those are captured on this website. You can see at the top, there are a lot of the documents that you need. So the written order template would be located here. We have an assessment template as well, which is also not required, but available. Some of the TAR forms are on here as well. It's still in the form section on a Magellan of PA as well. So this is a really good resource. We were very mindful in trying to make sure that we could write down and give you guys access to as much as possible so that there were resources when you come to make a referral or get involved with IBHS. So I would encourage you to bookmark that if you can. And OMSAS themselves, the state put together their own IBHS webpage, which is also really helpful and a great resource, which is the link right here. The regulations are on there. They have an FAQ document. They have links to a provider search for finding out in the entire state of Pennsylvania who has IBHS licensure. There's a lot of great resources on this page as well. Encourage you to look at that. So on their website, this is kind of what I was talking about. They have the regs, they have field office contact information, they have family fact sheets, and they also have an email address for specific IBHS questions for the state. So we have a good amount of time for some questions or clarifications that are needed by this group. Leah has been staffing our questions. I don't know if we got any. If we didn't and you're thinking of them now, that's fine. I'll give you guys a couple minutes to write them in if you're thinking of them now. And we'll be happy to try to answer questions as you have them.
Hi, Kristen, it's Leah. Hi, everyone. We just have one question if this PowerPoint is going to be shared, which I believe that is the plan as long as with the recording of this as well.
Yes, yes. So it does take a little bit of time to get the recording back, and then we will ask for it. So hopefully by early next week, we would have it posted on that provider IBHS webpage and the Magellan of PA that I talked about. It will have the webinar as well as just the PowerPoint next to it. So if anybody missed it, wants to hear it, wants to have this as a frame of reference, it will be available within the next few days.
And we have another question about BHT and school services. Are they currently allowed in the youth home during the pandemic? And when the schools are closed for the holiday breaks, do the BHT school services cease or can they continue?
So this is specific for what's going on, obviously, with COVID and an emergency declaration that the governor put in place in March, which impacts the way that BHRS, IBHS services were delivered. So they did allow that if a child had a prescription for TSS, BHT within the school setting, prescribed that way, that without any paperwork submitted during this pandemic, they could transition that service support into the home and community instead. Many of the schools went virtual and things like that, so they were still continuing to assist sort of in some setting in the home. Obviously, you have to look at whether it's clinically appropriate. Some children that are getting support in the school, it may not still be appropriate to support them in the home, even though it technically is allowed without any type of paperwork submitted for that. Again, this is specific to the emergency declaration. So if that should end, then that stipulation would also be changed and it wouldn't be flexible. So the same thing applies. So if the written order talks about school and they obviously are not in session for a certain period of time and it's written that way, then the services would not be able to be provided at that time. The emergency declaration does allow the site to change from school to home and community, but not necessarily if there's some exemptions already written in.
Okay, we have a few more.
Sure.
For the initial assessment timeframe request for ABA, should we include an extra 15 days to account for treatment planning, or are we just requesting 30 days on the TAR also? Will the treatment plan development be included in the 96 units of the assessment hours?
Okay. Right, so this is one of our providers. So a bit more information, but yes, the regs allow for 30 days for the ABA initial assessment to be completed. Magellan is allowing an authorization up to 45 days. So that is the requested time frame. We're giving a little bit of that wiggle room. You still have to meet the compliance, and be compliant with the regulations. So I think
Okay.
the answer is the 45 days for the request.
And then I got another question. You mentioned that the written order update needed to be written by the original person. What happens if that person leaves the agency or is not available for some reason?
And they would need to explore a new written order. Again, hopefully based on who can write a written order and what's entailed in it is not as cumbersome to secure a written order a new written order as it would be to maybe do a new evaluation. Who can write the written orders is a lot broader. So right now, agencies are working to expand their ORB enrolled staff so that they have that availability. So yeah, you would need to explore a new written order in that scenario.
Okay, another one. Outside of the COVID extensions, what should be done if family compliance does not allow for the completion of the assessment within the time frame?
So at this point, we are asking that the providers continue to document their attempts. So even if you've offered to initiate services within 5 days and the family can't accommodate that, then I would document that you offered them, this date and, the family's unable to meet that. Again, the documentation will support what's necessary. Obviously, if the family is not able to accommodate it, that would take into account. So at this point, we are just asking that providers document all their efforts to be in compliance and the reasons that they're unable to be at that point.
That's all that I see at this point for questions.
We'll give another minute, but I do want to thank you all for participating. This was a really good group of people that were able to attend. We're hoping, and a bunch of names I didn't recognize, which is really makes me happy. We really wanted to try to get this message even beyond our provider network. We wanted to get it to the other levels of care that would make these recommendations to areas like developmental pediatricians. We're trying to reach the mass with trying to ensure that they know how to get our members connected with IBHS services and understand some of the changes that have been done. So I don't see any other questions. However, like I said, Magellan has our own IBHS email page. So if you think of something when you go to look at this again, you can certainly outreach us then. You can outreach if you have, if you're a level of care in Health Choices, you can outreach your care manager, and they can certainly assist with getting you the answer as well. We really appreciate your time and patience in trying to figure out this new level of care and rolling this out with us. So thank you again.